My name is Pat Iyer. I'm a legal nurse consultant who has helped attorneys with over 100 emergency department medical or nursing malpractice cases. The emergency department, also known as the ED, is one of the highest risk areas of the hospital. There are several aspects of emergency department care that makes it high risk for errors. The unpredictable flow of patients, the constant pressure to quickly assess and treat patients, the lack of a previous relationship with the patient, and the huge variety of conditions and ages of patients. Legal nurse consultants and attorneys may encounter plaintiffs who are dissatisfied with emergency department care. The public is increasingly aware of emergency department issues related to the quality of care. The American College of Emergency Physicians recently gave a report card for emergency care and found that the United States emergency department care was a D-. The risk begins right at the front door when the patient walks in or is wheeled through the door. Nurses make up the largest category of ED healthcare professionals. They're expected to quickly sort patients upon their arrival into categories based on their complaints, and then assist in the diagnosis and treatment of conditions ranging from medical, surgical, pediatric, geriatric, obstetrical, and so on. Any age patient may come into the ED, from a newborn to a 100-plus-year-old. Hours can go by with a light patient load, and then a busload of patients may arrive all at once. The stakes in the ED are high to deliver the right type and amount of care in the face of unpredictable workflow. Nurses are the professionals most often involved in triage. Triage is a process, not a place, in the ED. It's a process of sorting patients by their acuity or degree of illness. This allows the triage person to identify those in need of immediate care versus those who can safely wait. The purpose of the triage process is to get the right care to the patient in the proper amount of time. Depending on the hospital, the patient is assigned a category of either emergent, urgent, or non-urgent, or a number from 1 to 5. Here are some problems that could result in an injury to a patient. First, the patient may be given the wrong triage category. Instead of being identified as a patient with an emergency or an emergent problem, the patient is seen as someone who does not immediately need care. The patient is sent to the waiting room to wait his turn, and her condition or his condition gets worse. There have been several cases I know of patients who either died or got much worse in the waiting room. Secondly, there may be a delay in the triage process, resulting in a patient with an emergency who waits too long for attention. Triage should be accomplished within 10 minutes after a patient enters an emergency department, but many emergency departments are unable to meet this standard. I discussed liability issues associated with emergency department care in my new book, Analyzing Emergency Department Medical Malpractice Cases. I wrote this book to assist legal nurse consultants and attorneys who handle emergency department medical malpractice cases. Get ordering information at the link below.